The other subject that's been causing a great deal of concern as we think of the 2GB Go Health program is the alarming reports concerning a number of areas. One is something which was said by Dr Peter Stanley when he addressed recently the Royal Australasian College of Physicians in Perth, and he made this statement that sexual promiscuity in Australia is responsible for a resurgence of some diseases which were almost eradicated. And he has made some very strong statements at that particular conference. He is a visiting consultant at the Fairfield Infectious Diseases Hospital in Melbourne, and says that complaints such as hepatitis A and gastric infection had re-emerged among promiscuous homosexuals and in heterosexuals. And so we'll be talking to Dr Stanley on our program and just find out what made him say that, the studies that he's been engaged in, the work that he's been engaged in, and we'll be speaking with him. And we'll also find out what's going on in the area of blood transfusions and what is the connection in that area. If there is a connection, what is the connection, and so on, and how this should affect the New South Wales Red Cross Blood Transfusion Service. And I would imagine, because of some of the statements that have been made, and I know they are very short of blood, that many, many people in the community should take note of that shortage, and those who are in good health should do all they can to donate blood. Well, that's some of the subjects we've lined up for you tonight. Now, in our society, we have lots of pluses and negatives, and one which is causing great concern at the moment, and particularly because of our Go Health program on 2GB, I thought it would be good to hear firsthand from some of the experts concerning the upsurge in some of these diseases which we haven't heard much about in recent years. And one of the specialists who's been speaking out recently is Dr Peter Stanley, who is the visiting consultant at the Fairfield Infectious Diseases Hospital in Melbourne, and he recently was addressing the conference of the Royal Australasian College of Physicians in Perth, and we're very pleased to have Dr Stanley on our program now. You there, Dr Stanley?
Yes, good evening.
Thank you for coming on our program.
Yes.
Sorry, a little bit later than I expected. I hope it hasn't inconvenienced you.
No, that's fine.
I thought it would be good to hear firsthand from you, Dr Stanley. Perhaps you might explain to our listeners some of the main points that you made in your address at the conference in Perth. We always get fairly sensational headlines: doctors alerted on gay plague threat, virus upsurge blamed on sex habits, and there was a quote, sexual promiscuity in Australia is responsible for a resurgence of some diseases which were almost eradicated. Would you like, in your own words, to explain the main thrust of the address that you gave at the conference in Perth?
Yes, well, the main thrust of my talk was that to alert physicians, those not particularly concerned in the management of patients with sexually transmitted diseases, to alert them that a number of diseases may be referred to them under a different guise, but in fact may be sexually transmitted. And I mentioned some of these, such as hepatitis A and bacillary dysentery, diseases which in this community have reached very low levels, and largely because of the improved standard of living that we enjoy, that these were starting to reappear as sexually transmitted diseases in our community. I also mentioned that we were starting to see some of the less common complications of diseases such as herpes simplex, genital herpes, the less common manifestations of gonorrhea and syphilis, and of course then went on to talk about the very now notorious acquired immune deficiency syndrome.
Yes, it's sort of, that's the one that the press were calling the gay plague, so-called gay plague.
That's right, yes.
AIDS is the lettering for it.
That's right,
AIDS.
the abbreviation.
Yes, because there's been a fairly fierce debate, which had nothing to do, I think, with your address, but it's been triggered off at the same time over the whole question of blood transfusions. But I guess there is a link, because in your address you referred to the fact that there have been now at least one confirmed case, and apparently there's now 2 confirmed cases in Sydney, which have caused the Red Cross Blood Transfusion Service to have some concern in case some of these diseases might be transmitted through blood transfusions. I don't know whether that's an area in which you have any knowledge as well of the situation here in Australia. Is that a possibility?
Well, it certainly, we don't really know yet what the cause of this disease is, but it's certainly the epidemiologic evidence that we have to date would seem to indicate that it is due to a transmissible agent, a microorganism, that can be transmitted sexually or via transfusion of blood or blood products. The majority of cases, of course, have been reported amongst homosexuals and those using intravenous drugs. But there have been a small number of people who have got this disease who have been transfused, and we believe that it can be transmitted by this method. Because there are no markers, particularly in the early stages of the disease, obviously people may, in the early stages of this, may be blood donors, and therefore there is the potential for spreading the disease by that method. The risk must be very, very, very small, and one obviously has to weigh up the cost-effectiveness of that when one considers how important, of course, our Red Cross service is. Blood is a very important product, of course, to us all.
There may be some new tests that should be developed. Perhaps it could identify whether there is one of these diseases in the actual blood itself. Apparently this is not always the easiest thing to do.
No, well, of course, we've come a long way with hepatitis B, where in the space of, say, 15 years, the virus has been isolated, tests have been developed, and now, of course, we have a vaccine. And there will now be a major thrust along similar lines to find the agent of AIDS and to develop sensitive tests for the detection of it, and in blood, so that the risk of acquiring this disease by blood transfusion will no longer be present. Now, how long this will take, of course, we can't really say at this stage.
I'm just speaking with Dr Peter Stanley, visiting consultant at the Fairfield Infectious Diseases Hospital in Melbourne. I'm just wondering, Dr Stanley, is your hospital specialising in this AIDS study, or is there some centre in Australia that would now be regarded as the main place? I gather in America there's one in Atlanta, I think, that's specialising in it. Would yours be the one here, or do you know of one yet that is specialising in trying to identify it and the causes and so on?
Well, in America, of course, they do have, as you mentioned, the Centre for Disease Control in Atlanta, and that is the agency, a very large organisation, which tends to organise and to generally conduct most of the research into new diseases such as this. We don't have anything quite the same in this country, but Fairfield Infectious Diseases Hospital is the only institution of its type in Australia, and one would expect that we would play a significant part in investigations of AIDS, and at the present time we are in fact looking at some projects to try and study this problem in Melbourne.
Are you in close touch with the centre in Atlanta too, then, or in some official way, or just as a concerned doctor? Well,
we do have unofficial links, and in fact most health agencies throughout the world do have unofficial links with the Centre for Disease Control. Most organisations like ourselves who are interested in infections do have unofficial links with the American CDC.
It seems, Dr. Stanley, that this AIDS disease has a very high death rate or mortality rate. Have you heard the latest figures from the United States? I've heard figures up to 70%. I don't know whether that's an exaggeration.
I think this is really the very frightening thing about this condition, that the mortality at the present time would appear to be over 60% for those who have had the disease for more than 12 months. So that, to my knowledge, there have not yet been anybody who has been totally cleared, that is, been designated as cured of this condition. The number of nasty, life-threatening infections they can get, of course, these can sometimes be successfully treated, but then, unfortunately, often further new infections occur, which are commonly fatal to the patient. So it's a very, very nasty disease, very frightening disease, and one with a very high mortality.
Well, I imagine the next question is, what should be done in our community to try to reduce the impact of these diseases. I noticed the report, which, whether this was a quote from you or not, it said that as these infections had re-emerged among promiscuous homosexuals and in heterosexuals, the only answer to the increase in sexually transmitted diseases was for people at risk to reduce their sexual activity or to become celibate. Is that the direction in which society should be moving?
Well, that was somewhat of perhaps a little bit of a misquote, but it's quite obvious that if you wish not to suffer from any sexually transmitted disease, let alone AIDS, then the best way to avoid it is to reduce the number of sexual contacts you have. And I think at the present time, certainly in the homosexual community in the United States, the gay bars in New York and in San Francisco are deserted. The trend, obviously, if one wants to be healthy and not to acquire sexually transmitted diseases, then one should reduce the number of sexual partners one has. It's a logical extension, I think.
Yes, it seems a pity, Dr. Stanley, that often, perhaps through television soap operas and other programs, you get one side of the story, the sort of the Playboy philosophy, without the whole story being told, that there is a cost often in some of these lifestyles. And I imagine it's probably going to be difficult to get that information out. Do you see any hope that perhaps there may be a more balanced educational program in our community and schools and through the mass media such as television?
I would hope so. I think that as a community at large now, and I think with this AIDS, I think it's bringing to everybody's attention that that there are these social diseases. It is inevitable that they will appear if one has a promiscuous society. It's an inevitable consequence of that, and that if we wish to be healthy and these diseases to be contained to a reasonable level, then promiscuity is out.
Well, perhaps some of the old-fashioned advice, of the mothers or the grandfathers that people may have laughed at in modern society, we may have to pay heed to it after all.
Well, I think the evidence is certainly there, isn't it?
Well, I hope so, and I think it's good that more members of the medical profession like yourself and others are providing the factual information, and which I think can have a powerful influence on our society, as well as religious and moral teaching and so on. I think it's good as well to have this factual information, and perhaps it may be an area in which the medical profession will have to take a more important role than they have in the past, because of the almost interrelationship, if you like, the interaction between these diseases and the community and so on. It's no longer a case of something just of interest to you in a laboratory. What you're dealing with is of interest and has an effect, the information on the whole of society. And I think that's something that perhaps maybe the medical profession should organise conferences for the general public as well as for the medical profession, although I imagine your hope by talking in Perth at the Royal Australasian College of Physicians was that they in turn would pass this information on into their various communities in which they operate.
Well, that's usual at a meeting such as that one passes on information to one's colleagues and receives information in turn, and thereby disseminating medical information to doctors and from them to the general public. Is
there any step that you'd like to just suggest in closing, Dr. Stanley, that our society should take? Is there any? Do you think there should be some grants from the federal government to special studies in this area, or is there any other proposal you'd like to put up for our listeners' consideration?
Well, I think there is, and I think that the direction that we should be taking, from my point of view, is fairly clear, and I think we need to look at the very high-risk group of patients. That is the homosexual population, the homosexual community, because it's within this group that we are going to find many of the answers they do seem to be the soil upon which this agent seems to flourish best of all. And I think we need to have very large studies, prospective studies, that is, having a large number of homosexuals studied, clinically examining them, doing various tests, and then prospectively following them over a period of time. And that's a very big study, and it does require a lot of investment in time and of course in money. And I think that this country, as well as the United States and other European and Scandinavian countries, need to put a lot of resources into helping combat this new problem, which is not just, of course, a problem of the homosexual community, but will, of course, affect all members of the community, as we've seen already with the Red Cross decision.
Yes, well, I've even heard now of some reports from the United States of where it appears that AIDS has affected some children as well. So I'm not too sure how many, but apparently there's been some cases now.
Yes.
So just how, as you were saying, it's difficult to know just how it's been transmitted, and it may be in some very simple ways, which is of great concern. Well, thanks very much for coming on our program tonight, and we'll certainly do all we can to assist you in your research, and I hope you'll keep us informed in the future too as to how things develop.
Good. Thank you very much.
Good. Thank you very much, Dr. Stanley. We've just been speaking with Dr. Peter Stanley, the visiting consultant at Fairfield Infectious Diseases Hospital, Melbourne, who's been speaking to the Royal Australasian College of Physicians in Perth about the what he regards as a very sad development, that is that diseases which were almost eradicated, that we are now seeing a resurgence of these diseases here in Australia. And of course, as far as we know, the same pattern is occurring in the United States, in most Western countries. And it certainly seems to be one of the fruits of the permissive society. People treated it as a joke, do your own thing, and eat, drink and make merry is expressing the Playboy philosophy, but there is a price to be paid, a very expensive one. You may have seen the case reported today where one young woman is suing the man who transmitted the particular disease to her. And this will be the first time that there's been a court case in the United States. So I don't know what effect that will have on the promiscuous people in society, but if it helps to deter some, then it may have some value. And we're going to now to speak to another specialist that we've lined up on our program who has specialised knowledge on this subject, and I think he's there now. Is that Dr. Archer?
Yeah, speaking.
Good, thank you for coming on our program tonight. I'm sorry I've kept you a bit later than I expected. Dr. G.T. Archer is from the Red Cross Blood Transfusion Service in Sydney, and I've just been speaking, you may have heard me speaking with Dr. Stanley in Melbourne, who was raising some of these questions at the Australasian College of Physicians in Perth, and I'm just wondering, for the benefits of our listeners, if you could bring us up to date with the situation in the area of blood transfusions because of this AIDS problem, and also the need that the Blood Transfusion Service has for additional donors to help. I gather you're very low on blood or have almost no reserves at all.
Well, the reserves aren't too bad, but what I'd like to do is sort of fill in what's happened as far as blood transfusion is concerned. We received a letter from the State Health Department 2 weeks ago telling us of the first case of AIDS in Australia.
Mm-hmm.
And we subsequently found out from Professor Penny that this person was in fact a homosexual and had at least 100 contacts since the time he arrived in Australia last November and the time of his diagnosis. The second case has been found in Melbourne since then, again in a homosexual and again in a person who's had many contacts. So this really, I suppose, means that we now have in Australia the same scene that was in America in 1979 when the first cases were found of a disease with a very high mortality rate, predominantly in homosexuals to the extent of about 70% of cases. The first 300 now have been followed up, and the mortality rate, I think at the present time, is 50%, but is expected to get up to 70%. So we have a very serious disease that has come to the shores of Australia. Now, the risk of actually transmitting AIDS through blood transfusion is not very great. But a blood transfusion service has to take the view that if there's any risk at all, then the donors should not be asked to donate. And the evidence that it is transmitted by blood transfusion really has come from the haemophiliacs. I don't know whether the listeners know, but AIDS is known as the 4H disease because it occurs in Haitians, people from Haiti, in homosexuals, in heroin, and in fact other intravenous drug substances that are used intravenously, and in haemophiliacs. Now, the reason that it occurs in haemophiliacs is probably by blood transfusion, and why it's been found in haemophiliacs more than, say, people who have ordinary blood transfusions is because when you make the concentrated material that's needed for the haemophiliac, you have to pool, and in America they pool something like 20,000 donations together, make the one pool to get the factor 8 to treat the haemophiliacs, and you've only got to have one contamination in that 20,000, and then the final material you see is infectious. So it would be expected that you'd see this first in haemophiliacs for quite a while. The disease has only been known since 1979, but for the first couple of years there were no cases reported following whole blood transfusions. But these are now appearing, in fact, in the recent Lancet that arrived here in Australia just last week. They describe a case of an exchange transfusion in a newborn babe, and about 6 months later the baby started to get symptoms of AIDS, and it died at the age of 2 years. They tracked back on the donors and found that one of the donors, who was quite well at the time he donated his blood, subsequently was diagnosed as having AIDS, and then he died.
Yes, apparently that's one of the most dangerous aspects of AIDS, is that it can be dormant, but still dormant to the person that has it. There's no outside signs, but they could in fact be a carrier. Yeah, that's right. So our reasoning is that the disease is in Australia now. There are people in Australia with the disease. If they have a large number of contacts, as they seem to, then the pool of possibly infected people is increasing fast, and therefore we decided to try and inform the homosexual community of the risk that possibly that contaminated blood could cause AIDS in a patient, and the thought was that we should go to the media. There's been a lot of criticism of this, that maybe there should be some other way around it, but you can't, for example, ask a donor coming to a reception desk, is he a homosexual? This is not permitted because it's still an offence in New South Wales, and the person's not going to answer that question correctly. For the same reason you can't put a notice up on a wall. So we took the view that what we should do, and this has been done in America to a considerable degree as well, is to announce in the press as widely as possible the possibility of AIDS, a serious disease, being transmitted by blood transfusion, and then asking the homosexual community, the promiscuous homosexual community, would they please refrain from donating. So in fact, though, you would still have no guarantee that one or more may still make a blood transfusion?
No. It's all asking people to cooperate. There's always the chance. I must emphasise, though, that the risk of transmission of AIDS by blood transfusion is fairly slight. We would hate the audience to go away, listeners to go away, thinking that all our blood is now contaminated.
No.
I think the risk is very slight, but this is the way we decided to go, to announce this to the media, which have cooperated very well, I must say. The only other thing that has happened, I suppose, of importance is that when the second case was found in Victoria, the National Red Cross organisation decided that this policy of limiting the homosexuals, the promiscuous homosexuals, from donating should apply Australia-wide.
Oh, I see. Right. Well, thanks very much for coming on our program tonight, and if we can help you in any way by using this program, please, for notices or announcements, don't hesitate to make use of it.
Good, thank you.
Good, all the best. Well, that was, we've just been speaking with Dr. Archer, who is the director of the Red Cross Blood Transfusion Service, about a very serious situation that they're now facing. We'll now go to the Macquarie News. We'll take some more calls in the open line. Go right ahead, John, with Fred Nile. Hello?
Good evening.
Good evening.
Good evening, Fred. I'd like to say something about homosexuals, but which I'm sure you'll agree with, although you might think it's rather strong.
Well, we're just running out of time. What was the other comment you wanted to make about the AIDS, or the gay plague?
Look, I congratulate you on your work on this, of course, but first of all, I object to the word gay being used. I think it's a beautiful word in the English language.
That's right.
Homosexual, or homo, is a word for them, and I'm very sorry for them, but I don't feel they should be allowed to work in our cafes. Are these people with these ghastly public toilet habits, are they handing out food at Lygon Street, Carlton, and around the Cross? This is where hepatitis comes from. And I'm wondering about this other disease, AIDS. Many of my friends won't have a bread roll at a cafe because they don't know who's in the back handling it. Now, if this disease is getting rampant, and a Sydney doctor told me only this weekend, I'm not supposed to mention it, and I won't mention any names, but it's much bigger than we think, this AIDS disease.
Oh, yes, well, that would be my belief as well. It certainly is in the United States. I think, what they're coming across are the most serious cases, and as I think Dr. Stanley or Dr. Archer said, that the cases here in Australia, the people have had 100 contacts and so on, that they're pretty extreme cases, and there must be a number of others that have not yet been drawn to public attention, or in fact who would be, when I mean by public attention, either medical treatment or through a venereal disease clinic, a sexually transmitted disease clinic.
Is it compulsory for them to register?
I don't know. Well, I don't think it's compulsory from the register, I don't think. In fact, a lot of those rules have broken down, even where doctors don't seem to be reporting patients that they examine in the way they used to.
Well, venereal disease, a doctor had to report it, didn't he?
Well, he's supposed to, but I gather that that's not being strictly enforced, or doctors are not enforcing it themselves.
What?
And I think this is another reason why this is spreading, as Dr. Stanley said, that a number of diseases which he felt and other doctors felt were almost eradicated have now come back in full flood. So it is a very serious situation, and eventually, as you're saying, a lot of innocent people can be hurt by some of these diseases which are quite contagious, and as he was saying, through blood transfusions, even if it's only a small percentage.
Well, how do you feel, Reverend, if you're going to a cafe knowing that through the bowel is transmitted onto the hand hepatitis, and there's other diseases through the bowel apparently too, like hepatitis is, and they're handing the food? How do you feel about that, or don't you worry about it?
Well, I think everybody is concerned about it, and that's why you try to use cafes and so on that you have trust in, they have good reputations for cleanliness and so on. But as you're indicating, it may be something which happens with a member of the staff which is even unknown to the owners of that particular cafe. So it is a very serious situation, and I think it's...
The more publicity, the better then.
That's what I think so. I know we got a lot of criticism last year, and I was very strongly criticised on this program for interviewing doctors about it, based on the American experience, and we were doing that to try to even warn the community, but even to warn the homosexual community of a very serious situation, and all I got for that was attacks left, right and centre. But if the homosexuals don't take notice, they themselves will be dying. As the doctor said, the mortality rate is from 50 and getting up to 70%. So if they don't pay attention, they're in for a pretty serious situation. So thanks for calling in and giving us a bit of history, as well as your opinion. I appreciate that, but just running short of time.